thumbs up, okay?
Oh, yeah, we're there. Now you got to
Roll call, please.
Kokendorfer,
Here.
Bowman, Middleton,
Here.
Wiper,
Here.
Zach, here, Hoffman.
Here.
You have a quorum.
Thank you very much. Approval of our, do we have Pledge of Allegiance? Where's that?
May 11th, 2016 meeting.
Oh,
I'll
please
move
join
it.
me in the Pledge of
Oh,
Allegiance.
okay.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We have before us the minutes of May 2nd and May 9th, moved by Commissioner Middleton,
Okay.
supported by Commissioner Kokendorfer. All those in favor signify by saying aye.
Aye.
Opposed, same, motion carried. You have before you the agenda for this evening, this afternoon, I mean. We're deleting item number 3. Any other additions or corrections to the agenda? Hearing
I'll
none,
move
moved by
agenda
Commissioner
as
Weipert,
corrected.
supported by Commissioner Zach. All those in favor signify by saying aye.
Aye.
Opposed, same, motion carried. Is anybody here for public comment? Hearing none, moving right along. The first item is Department of Health and Human Services Health Division, Michigan Department of Health and Human Services 2018 Childhood Lead Exposure Elimination Innovation Grant acceptance.
I'll move it.
Moved by Commissioner Weipert, supported by Commissioner Kokendorfer.
Good afternoon. You get me this afternoon and not Kathy. So in front of you is a grant acceptance for the Health and Human Services Department Health Division. And as part of this grant, they are requesting the creation of one special revenue, part-time, non-eligible, 1,000 hours per year public health educator position. The position will be conducting education and presentations on this grant.
Okay, does anybody have any questions? Hearing none, roll call, please. Oh, Commissioner Weipert, go ahead.
Well, you weren't part of it. You were part of the application process, but it looks like it's going to go on for a whole year, all the way through 19.
Yes.
Of having staff come up with a protocol for educating people on lead and come up with a toolkit for doctors. So I think it's a pretty interesting, good thing.
Yeah.
That's all.
Thank you. Roll call, please.
Middleton,
Yes.
Wiper,
Yes.
Zach. Yes. Kokendorfer,
Yes.
Hoffman.
Yes.
Motion carries.
Thank you. The next item is Department of Public Services, Community Corrections, Michigan Department of Corrections, Office of Community Corrections Comprehensive. Who comes up with all this? Community Corrections Comprehensive Plan and Application for fiscal year 2019.
I'll move it.
Moved by Commissioner Middleton,
support it.
supported by Commissioner Weipert.
Good afternoon.
Hello. Good afternoon.
I'm Barb Hank, the manager for Community Corrections, and as you've already indicated, this is for our FY19 grant application. For next year, we are asking for just over $1.7 million in funding to continue to fund the programs that we have in Community Corrections.
Okay.
Go ahead, Commissioner Middleton.
What was the amount last year?
Well, actually, this grant application, we're asking for $117,000 more than we received in this fiscal year.
Okay, good. Okay.
Okay. Any questions? Mr. Weipert.
Are we likely to get it? I mean, it's.
Likely, we'll see. We did take a cut of about $64,000 last year, so I asked for that funding to be restored plus some. It really just depends how strong the other counties' applications are, and we'll find out in August.
I mean,
Go ahead.
yeah, I mean, this is every one of the community correction programs, 511 and this is every bit of the community correction. So if you don't get it all, are you going to proportionally reduce? Or?
Yes, I mean, we have contractual services, contractors that are funded through this this grant. So we will have to take a hard look and see. There will have to be something that will be cut. Last year with the funding cut, we lost a part-time position. So that just remains to be seen. We're hopeful that we'll get the money. We've had increases in our utilization, and I think the application is strong enough to support that and to support the funding, but you never know at the state.
Thank you.
All right, Commissioner Middleton?
Yeah, I think you did better than the sheriff's. I read this morning that the Marine Division asked for 500,000 and they got 200,000.
120.
So it sounds like you're doing better than they are.
I hope so.
Okay, any other questions? Commissioner Kokender.
Sure. You had mentioned last year that 64,000 was an award to us. How do we do in previous years? What's that track record look like?
It varies, and there's, under this grant, there's different pots of money. So there's plans and services, there's residential services, there's a drunk driving, jail reduction fund. And so over the years, sometimes we get more in one area than another. And so while we receive about the same amount of money, those pots can vary from year to year depending on our utilization numbers. We actually have done pretty well. That's the first time that we really had taken a reduction in a number of years. But overall, the funding has been stagnant for probably 8 years. So as more counties ask for money and for more money,
Yeah.
the same amount is,
Yeah.
is
The pie's
there
not
to go
getting
around.
bigger.
Exactly.
Right. Got it. Okay, thank you.
Any other questions? A roll call, please.
Whiteford,
Yes.
Zach,
Yes.
Kokendorfer,
Yes.
Middleton,
Yes.
Hoffman.
Yes.
Motion carries. Or Bowman.
That's a yes.
Just say yeah.
$1,700,000 on the
This
grant.
is
for community
item number
corrections.
2, a grant. We get money.
Thank you.
Motion
Maybe.
Thank you, yes.
Motion carried. Thank you. The next item is Human Resource Department extension of the Merit System Certified Eligibility List. Moved by
I'll move it.
Commissioner Wiper, supported by Commissioner Kokendorfer.
Certified eligible lists are in effect for 6 months. The HR committee may approve to extend the list for another 6 months. We're recommending to the HR committee for its
Okay.
review and approval to extend the following 25 eligible lists another 6 months.
Okay, any questions? Hearing none, roll call, please.
We can do a voice vote on this one if you'd like.
All right, all those in favor signify by saying aye.
Aye.
Opposed, same. Motion carried. Last item, Human Resource Department 2017 Wellness Program Report. This is just for information.
Right. Receive and file it.
Thank you.
Good afternoon.
Do you need
Good
a motion to
afternoon.
receive and file?
You look well.
Well, thank you. I haven't been here in about 2 years, so I'd like to introduce myself and Dawn Hunt, who's with me today. I'm Stephanie Bedricky. I'm in Human Resources Benefits Administration. Our unit oversees wellness, employee recognition, Little Oaks Child Care, and our employee assistance program, so the work-life benefits for HR. The report that you have in front of you is very detailed. It has our program statistics and depth, but we're going to hit some of the highlights that we'd like for you to have as key takeaways today. So a little bit about what we do. Some of this is a refresher for some of you, but valuable to us nonetheless. We are here for the employees. We want to increase their engagement, increase their preventative measures for their health, and have health awareness. With that, it's a win for the county. In time, this develops a culture of feeling valued, increased productivity, and hopefully an improved quality of life for our employees and their families. With an engaged, healthy workforce, wow. This positively impacts the workforce, but also the bottom line for Oakland County, specifically in the healthcare benefit expenses, which have a history of growing and growing. I'm going to highlight the phases that we've been through because we have been around for 12 years, but want to note that this is something that we continuously do. So we're continuously assessing engagement and also measuring our success, but also trying to keep it relevant. But first I want to talk about the county population. You're well aware there's 3,500 full-time employees, and with a program of this nature, there's a lot of things that our unit needs to keep into consideration. We have to look at the audience and try and understand what sort of structural workforce challenges and barriers that we encounter, because that's a constant thing going on with the scope of work that we do. The county has over 30 locations. 30% of those full-time employees are located off-site of main campus. 25% of the full-time employees are working a shift, or 24/7 operations. We have to consider, how do we reach those on the midnight shift, and how do we get them engaged? Even more than that, we have employees in the field working out of vehicles, and they also don't have access to a computer, those sorts of things, if that's our primary source of engagement. So some of you may remember the beginning implementation days when we were asking for funding for this program. So we did develop a wellness committee. That committee stands today. It represents every department within Oakland County so that we can further understand the obstacles and challenges that each division and department has. In the beginning, we hosted a contest for employees to create a logo for the program. So this logo here was created by a county employee. So we have that county employee ownership in our logo. We held a fundraiser for the initial funding of the program. Our mission statement is listed here. This is not just about county employees, it's about their quality of life with their families, dependents, and retirees. And once we received funding, we designated our wellness coordinator. Many of you know Dawn Hunt. She's been with us since implementation and started as a one person with Nancy Scarlett, growing this program to what it is today, 12 years later. So in our implementation, we hosted a kickoff. Everything's listed here of what we were doing, but what I want to emphasize is that Weight Watchers at Work has been on campus for 12 years. It's still going strong. We have 60 people at the medical examiner attending each week. We have requests for more and more participation. Sometimes we have challenges, though. Those would be access to buildings. While security is wonderful on campus, it's hard to get spaces that are available that all employees can access. So we're excited about the participation. We've also had outreach at district courts and other locations for Weight Watchers. So after 12 years, we're proud of that. Our Lunch and Learns and Wellness Fair was higher than ever last year. Our Lunch and Learns are also in great demand. We've doubled, tripled in participation and have them on wait lists. So with our team, we're really excited, but we are, one of the challenges we have is to keep up with the demand. Employees are engaged and the demand is high. We hosted biometric screenings the first year, and that began more of our engagement in our assessment process, trying to assess if our efforts are having results. With building awareness, we have value in our partnerships. We try very hard to leverage support from leaders and elected officials like yourselves. We have Clerk Lisa Brown, highly engaged, attending so many of our wellness events, and it really sends a message to the employees. So with our internal partnerships, we try and leverage leadership, and we get support from the Sheriff's Department. They've partnered with us on many programs, and by advocating for this program, it sends a great message to our employees, and it's very impactful, and it's critical to our program. So thanks for that. But that's one of the reasons why we want to share so much with you today. For our external partnerships, we had to build a vast network of organizations because we use them to leverage resources for employees, but they're also our subject matter experts in some areas that we try and bring in and share. Along with our engagement, these are the sorts of efforts that we do to track participation and track how well things are going, or if we need to scrap a program that's not being well received. So we're tracking all kinds of marketing efforts and statistics to try and constantly assess and evaluate if we're making our mark with those sorts of programs. With engagement, we have our Oak Fit initiatives. These are the various things that we offer to county employees and extended family to keep them engaged in the program. The money bags depict cost. So if there's one bag, it's no cost or low cost. As you can see, that's the majority of what we offer. And as you can see, Farmers Market Day, for example, is a $5 coupon to buy fresh fruits or vegetables locally. So that's also relatively a low cost. And then health screenings, one of our biggest high cost programs, is critical to our programming as well. It helps identify when an employee might have a high risk chronic condition that they're unaware of. How many of you got your health screenings this year, if you want to self-nominate? So you're aware of the program and of the value that we find in it, and we get those aggregate reports from that programming, and it helps us kind of assess, design, and develop our future programming. I thought I heard somebody ask earlier what our participation rates were in this program. As you can see, we've plateaued a bit. Over the last decade, it's remained in the high 50s. Now, this encompasses those who get their screening, but then also do the online assessment. If we're only looking at those who do their screening, it's in the low 60s. While we strive for higher numbers, the plateau we're okay with. But industry trends indicate that when they are not connected to healthcare, connected to benefits with an incentive, it's actually 40 to 50% participation. So we're in the upper 50s. We feel happy about the voluntary program getting that much participation. This chart is an illustration of those employees that get their health screening and are immediately referred to a physician. So they have high blood pressure or elevated glucose, and they are at risk. They need to go right now. In the beginning of the program, when we had only 44%, almost 15% of those individuals were sent to a physician. We look at these results and we think that this illustrates engagement, preventative measures, and awareness, and we're proud of these numbers. As far as cost savings, this chart, the red line at the top, so another purpose for this program when it was implemented was the rising cost of healthcare. I believe one year, I don't know, Jennifer, you would confirm, it was like almost 20%, I believe, from 2006 to 2007. From there, we tracked industry trends where it was consistently around 9%, so that's the red line going up, and then it kind of tapered off to a 3%. The cost of medical care is the green dotted line below, which shows we feel that this chart illustrates a bending of the curve of those healthcare costs and what Oakland County has incurred through their benefit plan. We do not attribute $190 million worth of savings for the 12 years of data here, but we do feel as though the engagement and awareness and partnering with our benefits administration team has contributed to that. Benefits, they've done contract changes and contract negotiations that would attribute to those savings as well. But we're looking at this chart as cost avoidance. The county did not have to pay that additional money because of these efforts. And lastly, we want to share all of our awards and accomplishments we've received over the years. Previously, we had a statistic that about 70 to 75% of county employees are engaged in our wellness program. We do feel that with our increased demands that number has increased. We feel engagement has spiked, and that's demonstrated by our wait lists for programming and our high demands for additional programming. We do have other counties, entities, and private sector companies contacting us for best practices on our wellness program. I think Don Hunt does a great job with fielding all of those calls and guiding those groups that reach out to us. And lastly, we just want to thank you for your support and for listening to this. And you have our business cards, and you have lots of information, and I'd love to answer any questions you have for us.
Commissioner Zach.
So, I was here and voted for it. I'm a big champion. Do my expertise is employee assistance programs and work with wellness. So, couple of things. What do we invest in the cost of doing these programs? Do we have an overall, we have the cost avoidance of $190 million.
Mm-hmm.
And how much do we spend as an organization on the wellness initiative?
We were just talking about that before we started because I didn't bring those exact numbers. Originally, it was around 400,000. It has grown a little bit since then. We've also grown into a unit where Dawn has, support from other team members. Are you comfortable with the number? Or?
We're just curious, what we're investing in. I'm all for it. But, it also, when we look at cost avoidance, what are we investing?
Mm-hmm.
The programming cost is around 400,000 for the programming that
Mm-hmm.
That's including health screenings and incentives.
Yeah, the incentives are about 200,000. It's roughly 400,000 just on programming.
So, a couple of questions and notifications looking at the participation.
Yes.
I know as being part of the Board of Commissioners, it's hard for me to participate. I can't, we can't access a lot of the HR portals from our iPads, or we have to have special permission from our home computers. We don't have offices. And so I think that it would, if the Board of Commissioners could access, given security, some of these portals, it might be easier. And then, having worked at a large healthcare organization for many years that has a wonderful wellness program, working with them, one of the things that they did is they paid more money for the incentives to do the health risk appraisal thing.
Mm-hmm.
And I think it's something, what's the return on investment? Should we be, study this compared to private industry? Should we be paying $250, incentive? What's our return on investment? Because I think that our rate is low. And what would we get from that? I think it's a worthwhile look. If we increase the participation, what are we going to save? What would it cost us if we did that? That's just, I know that there was a big difference in the healthcare provider that I worked at when they raised the amount of incentive. Or maybe it was, they did it maybe towards your copay on your insurance or some way of incentivizing it more than $100. The other issue, it's still, accessing. I go for my annual physical around the same time. I'm looking at all these numbers. And one year, I think I filled out an external form and submitted it. It's such, there's easier ways to do that. If you really want an aggregate. This year I said, I'm going to my doctor. Why do I have to, I'm watching my health. Why do I have to, take this form to my doctor, bring it back, sit here, whatever. I didn't do it. So can we streamline it in an easier way? And I don't know if there's other employees feeling the same way I'm feeling. Maybe if there were a higher incentive, maybe employees might say, oh, I really want more money.
Mm-hmm. You make very good points and things that brought up thoughts that we've been chewing on. I do want to give a little feedback on some of the pamphlets that Dawn provided to you. There is a URL on there, oakgov.com/wellness. Because of what you said, Commissioner Zach, about not being able to access the website, about, I don't know, a few years ago, that website was moved from behind the firewall. So it's accessible to anybody off campus, and we also wanted families to be able to access those. So if the wife is the one that's really engaged in the family's overall wellness at home and they don't work here directly, they can pull up all that information. Do you see it on there?
Is it the oakgov.com/wellness?
Yes.
So that's an open door.
It is.
Yes. We don't broadcast it everywhere, but but it is accessible.
Yeah, we're on cable, so everybody knows.
Thanks for the reminder.
Employees, now we know that here, employees and families, do they know that? Yes.
We feel we've shared that, but perhaps it's something we look at. How are we sharing that, and do we need to refresh that communication?
We're doing a mailing, and I really appreciate best practice that you mail about the employee assistance program and that comes home. I'm just wondering if you can have a sticker or something like that. We have the cost of that, also saying you can easily access this program at such and such.
Thanks for that feedback. There was a second item you mentioned. Yes, the physician forms. I do want to say we have rotated our vendor 3 times in the last 3 years, so I can understand the what you experienced, and you're not the only one that said that. We hope that we have continuity with a vendor coming very soon, and that we'll be able to make that a smoother process.
Well, and also this large healthcare provider that I worked for, it was on, we could access the form, it was promoted. Every employee knew that when they went for their doctor screening, whatever, they carried that form with the results as part of the program. We don't really promote that idea here.
Okay. That's good feedback. And
we might save money, too, from the standpoint they're going through physical. Why do I need to do blood work again or whatever,
Mm-hmm. Yeah. You make very valid points. Absolutely. About the incentive, yes, we would love that idea entertained as well.
I'd like to see you, comparison shop and say, what are some people employees doing, counties, and, a cost-benefit analysis for us to consider.
Okay. Thank you.
Any other questions?
Can I just add one more thing?
Sure.
I have a couple lunch and learn flyers that I also included, but there's a couple more coming up that I think the Commission would want to know. We are doing in July something on the opiate epidemic, communities in crisis, working with the Sheriff's Department, also with Community Health Network and Brian's Hope. They'll be here on campus to do like a panel discussion and talk about that. Human trafficking has been really big for the commissioners. In August, we have Teresa Flores coming. We've been working with Lieutenant Reyes, also at the Sheriff's Department. So she's going to be doing a presentation for us as well. So we want to reiterate your message to our employees and make sure that they're hearing it as well.
Thank you very much. Are there any more questions? Thanks for the presentation.
Thank you. Thank you very much.
Stay well. All right. Motion to receive and file that report. Moved by Commissioner Weipert, supported by Commissioner Bowman. All those in favor signify by saying aye.
Aye.
Opposed, same. Motion carried. All right, we have some communications. Receive and file. Moved by Commissioner Kokendorfer, supported by Commissioner Middleton. Before I vote on that, I have a question. Under Sheriff, there's a thing in here about DNA capacity enhancement and backlog. Do we have a backlog on DNA?
No, but we're going to. That's the name of the grant, it's DNA backlog. So we currently have 2 analysts. As you know, we just opened the lab up several weeks ago, a couple months ago. Already solved the homicide for Oak Park PD, Oak Park Public Safety, turned it around in 3 days. We anticipate with the advancements in DNA, we have room for 4 analysts in the lab that's been built. We have 2 now. This will allow us to add a 3rd next year.
Okay.
Fully funded by the federal government grant. And right now we do not have a backlog, but we just announced to the local police chiefs we're open for official business. We were just doing internal cases to start. You got to crawl, walk, run. So it's the old saying I told you, if we build it, they will come. Well, they're starting to come. So we're in anticipation of this money became available, and it will definitely help us try to keep our heads above water.
Okay, when we do work for different police departments, do we send them a bill for that?
No, sir.
Just part, okay.
County taxes pay for that.
Okay, just wondering. Thank you. Any other questions on the receive and file? All right, all those in favor signify by saying aye.
Aye.
Opposed, same. Motion carried. Is there any other business here today? Okay, we're properly adjourned at 2:03.